Thank you very much for that. Great. Now, mPower Morag Barrow, 5 minutes.
Thank you. I'd like to take this opportunity to introduce you to the mPower project. The mPower project is a European Interreg VA programme funded project. It's 5 years and it began beginning of January this year until 2021. mPower is aimed to stimulate transformation in older people's services across the border areas of the counties between the Republic of Ireland, Northern Ireland and the west coast of Scotland. I'd like to start again just by thanking you all because you are part of these health and social care teams that are delivering models of care that help people to live longer, healthier and happier lives. Some examples of people that we'll all recognise. But let's not forget about the millions of other people that are not quite so fortunate. Those who have limited income, who have limited mobility, who are housebound or who have restricted access to technology. Some of these facts you'll have heard today already, you'll all know them already as well. 60% of the deaths are due to long-term conditions. By the age of 65, 2/3 of people will have more than one long-term condition. 80% of GP consultations are a result of long-term conditions, and 30% of these presentations are not medically required to go to a GP. On a positive note, 60% of people own a smartphone, 52% of adults have a tablet or access to a tablet, and 75% of the population go online for health information. So mPower will enable people to live healthier lives at home. In doing so, we will hope to reduce unnecessary presentation to primary care when it is not required. We're going to be targeting citizens that are 65 years and older and have one or more long-term condition. And the exciting thing, I think, operationally, is that we are aiming to deliver one single operational service, not just across 7 health and social care partnerships, but also across 3 countries. So again, operationally, lots of exciting things ahead if we can actually deliver that. The partners are NHS 24. We are the lead partner in this project. From a Scottish perspective, we have the Western Isles, we have Dumfries and Galloway and Ayrshire and Arran. Our partners in Northern Ireland are the Southern Health and Social Care Trust, the Western Health and Social Care Trust, and the Health Service Executive in the Republic of Ireland. We're working with cooperating and working together, who are an organisation that have been used to delivering cross-border projects and have been a lot of success there. And we're also working with partners from the Scottish Council, voluntary organisations, and the University of Highlands and Islands, who will support us in terms of the comms and marketing and the evaluation. The partners at this point in time have chosen their deployment sites. They've taken into consideration things like social isolation, deprivation factors, demand for services, and also the community assets that are available for older people. But one of the really exciting things that we're really pleased to announce is that a couple of the areas are looking to actually develop exemplar digital GP practices or digital clusters as well. We will hothouse some of this activity around e-health interventions and social prescribing to actually monitor what the impact could be on primary care at a time when we know primary care is challenged. So again, from the project infrastructure point of view, each of the areas will have a local team that will actually work within the board areas. There will be social navigators, community navigators, and there'll be implementation leads who will drive locally development and delivery of social prescribing and e-health interventions within the local areas. And they'll be supported by an international team that will comprise of business leads, a programme manager, and PMO support as well. From an output perspective for the project, we are required to deliver 4,500 e-health interventions across the 7 areas over the 5 years. And we'll be focusing on VC-enabled care or consultation, integrated home and mobile monitoring, and the use of apps and telecare. And also from a social prescribing point of view, we will be delivering 2,500 wellness action plans, which again, there's some examples of connecting people up, connecting people into clubs, or just connecting up old friends that haven't seen each other for a while. Last plug is that the recruitment will be starting fairly soon, so if anybody's interested in any of these posts, please get in touch with us as well and keep an eye on the show website and various papers and so on as well. We're hoping to start recruitment in the next couple of months, so thank you.